medicine for pediatrics reference tape that has different color codes, if we can all see. There's gray, pink, red, purple, yellow, white, and blue, and orange and green, okay? And on each side, one side has resuscitation medications, the other side has ET tube sizes and things like that, okay? So it has all the information you would ever need. This is like a casualty app, but different. So I hope we all have the casualty app. Okay, great. Do we know how to use this Broslow tape? For the ones who've had it, who've seen it before, how have we used it? Anybody?
I think you place it on you lay the child down and place it
Yes.
on the side.
Okay, great. Pauline, maybe you can help me distribute. I have handouts for you guys. If you don't get one, just let us know, and then we'll print more for you. Just hand them out. Thank you. Okay, so Broslow tape, yes. Like we said, it works on the principle of ideal body weight, okay? So it's, for you to calculate ideal body weight, you need the baby's height. Sawa sawa. Even adults, if you want to calculate ideal body weight, you need the height, okay? Let me give you guys 1 second till you get your papers. Ta-da-da. Pediatrics are not small, adults. Yes, they are special. Okay. All right, good. So if we can all look at the Broslow tape, it has a red tab at the top. Let's look here. Hi, yes, it has a red tab at the top. If you can all just try and appreciate, I know you, unless you have red-green color blindness, you can see a red tab at the top, right? So it says measure from this end. So the measurement is red to the head, okay? And then you measure all the way down till the heel of the child, okay? So red to the head till the heel. This one lands at white, okay? So if you look at the white section, it has all your ET tube sizes, equipment sizes that you need. And it also has all your resuscitation medications up to the dosage that you need for that baby. So you see how handy this is? Yeah? I don't even need to know how many kgs this baby is, but once I use this, I can easily get everything they need. So those of you in the county, go squeeze your people. Tell them we need a Broslow tape. Okay? Great. So in other more advanced places, the Broslow tape comes with a resuscitation pack that is seen on the screen, and it is also color-coded. In each pocket, they have the drugs in the right dosage. They have the right size of the ET tube. They have everything that you would need for resuscitation. So all you do is just take that one pack, place it down and use it. Lakini sisi bado tuna nyenyekea. We're going to get there soon. Let's start with getting the tapes. Okay, great. So you don't need to memorize everything. All right, now tell me, what are some of the modifications when we come to resuscitation of a baby? Aside from the dosages being different and being weight-based, what else do we change? So let's talk about CPR. What changes? In an adult, we usually do what rate of compressions? 30 to 2. 30 compressions to 2 breaths. What happens with pediatrics? 15 to 2 when you're 2 people. Sindio? Yeah, and that's the age range from 1 to? Okay, we've said we've changed the rate, 15 to 2. But if you're alone, just do 30 to 2 until somebody comes to help you. But if it's a newborn, it's different, okay? For those who are interested in neonatal resuscitation, you will see this face again in the neonatal resuscitation session, and we'll talk about that as well, okay? All right. Also, in terms of hands, they're very small people, so we don't need my whole 200 kgs on the baby's chest. Sindio? Yeah? So we modify as well. So, like an adult said, it's 2 hands. Even older children, 14, 15, 16, those are adults. You can also use 2 hands. But if they're about 8 up to 8 years, you can use one hand on top and press, okay? The force that you'll exert is enough for them. If it's a newborn or an infant, you can use two-hand encircling or two-finger technique. Sawa sawa. So those are the rates that we're going to use. What about IV access? I'm giving you more Kenyas as we go along. IV access. Is it easy to find an IV for a child? It can prove very difficult, right? And in resuscitation, drugs are very important. So we need to give them, right? We're just struggling how to give them. So what are some adjustments we can use in pediatrics? Intraosseous, right? Intraosseous lines. It's a very important life-saving skill, which there's another station that will teach you how to do intraosseous access. But for pediatrics, it is the holy grail. If you try once, twice, just put an IO. You'll never go wrong. Sawa sawa. And then what about newborns? The ones who are born, we usually say, mtoto alizaliwa floppy, alizaliwa flat. So also those ones need to be resuscitated. And they might need IV access. Which one do we want to use? Do you want to start looking for yellow, sijui purple, sijui what? Umbilical vein. See, they have a vein that was connected to their mother. So it's just they're staring you like, hi, please use me. I'm here waiting for you. Okay, great. So those are some of the modifications in terms of IV access. So the picture on your left is intraosseous. Picture on the right is umbilical vein catheterization. Okay? Great. So, did you know you can also shock the babies? Some people didn't know, even me until very recently. I did not know that you can also shock babies, but you can, okay? Yeah, so the same way everybody's familiar with a defibrillator or an AED, has heard of it, okay? So when a patient goes into cardiac arrest, it could be that the heart is beating erroneously, okay? So you want to shock it back to life, right? So that it can start beating normally. That is by use of defibrillation, okay? So for children, it can also happen. They can have their heart beating in a non-functional way, yeah? Whether it's quivering, called fibrillations or things like that. And you want to apply shock so that you can restart it and get an organized rhythm going again, okay? So you can also shock them. The difference is where you place your pads, okay? If they're less than 8 years, you want to put anteroposterior. So you can use pads or paddles, okay? These are examples of paddles, yeah. So for kids, you peel off so luckily they have pictures of how you put them. Sawa sawa. So you peel it off and follow the instructions on the picture. Okay? It is foolproof, right? Because there are pictures. So if you know what a picture of a child looks like, you should be able to place it. So it's anteroposterior if they're less than 8 years. Above 8 years, we tend to treat them more like adults, and you can put them like the adult placement. The other modification is that the energy will be weight-based. So remember, we said everything pediatrics is weight-based. So the energy will be 2 to 4 joules per kg. Again, you don't need to memorize it. It will be either in your algorithms, the ones that I've given you, or it will be on your Broslow tape, okay? All right, now we move to the actual meat of it all. How do we resuscitate kids? What is the proper sequence of resuscitating a child? What do we think? May I like being spoken to? Yes, safety. You ensure you're safe, baby is safe. ABC. Before you get to ABC?
Response.
Check for a response, right? Baby whoever, are you okay? Yeah? You tap them as you're calling them. Sindio? Tactile and verbal, okay? If they don't respond to that, you want to shout for help. We never resuscitate alone, okay? Even the conference says, let's save lives. All of us together. We always work as a team, okay? You can never resuscitate a person alone. So you always need help because there are many things that go into resuscitation. All right, so shout for help, okay? After you've done that, you've shouted for help, then now you can go to your ABCs. See, everything follows ABCs. All right. Check the airway, make sure there's nothing. If there's something, you want to remove it as appropriate, right? If you're in a hospital and it's secretions, you suction. What else do you do to the airway? Position. Cindy, what ways do we use for positioning? Head tilt, chin lift, or jaw thrust. Okay. What position do you want for your children? Sniffing position. Okay. They have a big head, yeah? So you want them to be able to have enough air going in with the head looking up. Good. So we've positioned our airway. Then, what do you check after airway? Breathing. Okay. What are you looking for in breathing?
Chest rise.
If there's chest rise, good. If there are breath sounds, you can hear them breathing. True. If you have a stethoscope, you can also auscultate, right? What else are you looking for in breathing? You can feel the breaths on your skin. Okay, good. What else can you do? The rate, exactly, right? The rate, you want to see kids breathe faster than adults, right? And depending on the age and your handouts, you'll see which age range has what acceptable number of breaths. Another thing about breathing, what else are we checking? If it's normal or abnormal. Okay. Anybody who is gasping, child, adult, nephew, niece, grandfather, if they are gasping, they are tipping over into arrest. So you need to start resuscitation, okay? Gasping is equal to not breathing. Sawa. So we have a baby, we've checked airway, we've sorted, it's okay. Breathing, we found they're gasping. What do you want to do? Either they're gasping or not breathing, same group. You want to? You want to check for the pulse. Sawa sawa, okay? Because you'll be able to know, is the patient not breathing with a pulse or they're not breathing with no pulse? Sawa sawa, check for your pulse. And for kids, anything below 60 is the same as 0. Sawa sawa, okay, great. So we check for our pulse, maybe it's 100. What do we want to do? They're not breathing, but their pulse rate is 100. You want to breathe for them, exactly, right? So what is this called? Ambu bag with a detachable mask. There are different mask sizes that fit kids appropriately. Please always size your mask against your patient. Make sure it goes from the rim of the nose, bridge of the nose, up to the, just above the chin. If you use a big mask, what are you going to do? Nothing. If you use a small mask, what are you going to do? Nothing, right? And we need to breathe for kids, yeah? If you remember, kids are more likely to tip over into arrest due to respiratory issues. Cindy, so your mask is very, very, very important. Sawa, sawa. Okay, great. So we've said if they're not breathing, we want to provide rescue breathing. 1 breath every 3 to 5 seconds, okay? So that's about 12 to 20 breaths per minute. So it's breathe in, 1, breathe in, 1. What is it called? Finya. Squeeze, yes. Squeeze over 1 second and release over 1 second. Because you want them to breathe in and out. Cindy? Okay, great. So we've done the breathing, okay? So you do that for about 2 minutes, okay? When you do it for 2 minutes, you have to reassess or recheck. Cindy? So you check the breathing again. Mtoto bado ha breathe. Check the pulse again. Now it's 50. What do you want to do? Pulse is 50, baby is not breathing. Start CPR. Okay. So our baby is a 7-year-old baby and we want to do CPR. How will I start CPR? Tell me I do it.
7 years.
7 years, yes. And I'm alone. What is my rate? Yes, normal baby. Not an obese baby. Broslow tape haijafika bado, but we are starting CPR. So we've called for help, right? Okay. Kama haijafika, excuse me, saidieni tafadhali. Na munilete defibrillator ama AED. Yeah, okay. In the meantime, I need to start resuscitating. So we said 7-year-old, we want to do a one-hand technique, center of the chest, okay? If the baby is on the floor, get on your knees. If the baby is on a table and you're as tall as me, you can continue. If the table is high, you can get a step or you can lower the table. So, because the position you want to be in is directly above, perpendicular. See how I've locked my elbow? Even if you come and move me around, it's not going anywhere. And it is stay in that position because you're using your weight to push down against the chest. Sawa sawa. So you do 30 to 2. Luckily, somebody comes to help me. Somebody has come to help me. So now I can do, she'll do the bagging. So now I can do which rate? 15 to 2. So I go there, lock my elbow, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14 and 15. And then she gives 2 breaths. Sawa sawa. We are understanding how it's going. All right, good. Now, more help comes and they bring the AED. We want to connect it as fast as possible. Sindio? We want to check the rhythm and make sure either it's a shockable rhythm or non-shockable rhythm. Okay? So for this baby, anterior, posterior. Okay? Connect it to your machine and read the rhythm when compressions have stopped. So when they're bagging, you're reading. So you see how? You can't do it alone. Okay, good. So we check the rhythm. Okay. We can't shock the baby. It's not a shockable rhythm. You continue with compression. But now you're thinking, maybe I need to give medications. So you come and you try, oh, sijapata. Oh, sijapata. Now you want to move to intra-osseous, okay? Like I said, there's a lovely station for practicing, but you put your IO. Luckily, you have your Broslow tape. Measure your baby. Tuko hapo. Like, good. We're going to give adrenaline 0.5 mils. Sawa? Okay? So that's how I want you to understand pediatric resuscitation. Of course, hypoglycemia is a big thing, so you'll also check your sugars. Which fluid do we use for resuscitation of hypoglycemia? 10% dextrose, okay? That is the drug of choice for hypoglycemia in children. Adults, we use 50%. All right, but children, 10. They don't need as much. Sindio? Okay, great. Up to there, are we clear? Are we okay? Do we have questions, clarifications? Things, yes. Okay, there's an intra-osseous station. Defer your question there. They'll answer it, don't worry. Not that I don't know the answer. But pediatric resuscitation. Anything about the chest compressions, Broslow tape, or what? Oh, and then another thing, you'll notice this is a smaller ambu bag, right? Each ambu bag, depending on the size, has the quantity of air that's inside, right? So you can't use that one that's 1500 mLs on a child whose actual lung capacity is maybe 500. You'll burst the poor lungs. Sawa. So use an appropriate bag and mask. And then only blow until there's chest rise. Sawa. You don't have to squeeze the life out of the bag. The bag has not done anything to you. Be gentle. Sawa. All right. Questions, clarifications. Yes.
I'd like to ask.
Yes.
When we use the Broslow tape,
Yes.
and clearly baby, you can see baby is malnourished. But then the Broslow
Mbali. So those are some of the, what's the word, limitations of the Broslow tape. There's malnourished children and obese children, okay? So for malnourished children, again, ask the mother, what was the last weight, okay? You're better off going with her last weight. But if the baby is obese, you'll find, maybe you've gone at yellow. But you're like, mtoto, yellow is 12, 13, 14 kgs estimate. Kini unaona mtoto anakaa ako 30. You're allowed to skip over to the white segment, the next segment. You're allowed to size up, or again, ask the mother. Good. Aya. Another question. You can have a look at the Broslow tape.
What if you don't have the 10% dextrose?
Why don't you have 10% dextrose? Why? Huh? Okay, another thing. Sidebar, guys. Sidebar. You are your county and patient advocates. Everybody. Everybody is a county and patient advocate. Even in private hospitals, there will be fights. Oh, this thing is not here. Be your patient advocate. Sema, no, we need this. And then you guilt trip them. And please don't record this part. You tell them, unajua ni mtoto wako utaleta hapa na hatutakuwa na hii kitu. Emphasize the need for these things, okay? Because resuscitation is not about myself. It's about the patient. Because even me, if I collapse here, who is resuscitating me? It's not me. I'm not going to be like, okay, Jean, come, 1 and 2. And no, I'm not going to do it myself, right? It's for you to do the right thing to me, right? So the same thing, you will emphasize the point that we need these things for the patients. However, if even that doesn't work, there are many different ways of diluting your 50% dextrose. Lakini kama una 10%, tutakuwa na 50%. Yeah. So, number one, advocate for your people. But if that fails, there are calculations for diluting your 50% all the way down to 10%. Yep. Another question, clarification. I want us all to practice the chest compressions and the ambu bagging. And I want you to go down the sequence. Any other question, clarification? Yes.
Where do you approach where to do compression?
So compressions, that's a good question. Okay. So usually chest compressions, you draw a line between the two nipples. Okay. It's called an intermammary line. So a straight line this way. Then you just go slightly below. Okay. But at the center of the chest. I know the heart is on the left, but we're using the mechanics of the rib cage to compress the heart for you. So the best place to compress is at the center where you have the sternum. But make sure you're above the Zifi sternum. Sawa sawa. So that's a very good question. That's how you locate where to do chest compression. Even in adults, it's the same. Center of the chest, slightly below, but make sure you're not on the Zifi sternum. And then go, go, go. Hard and fast. Cha, cha, cha. Usually kids, it's a third of the AP diameter. Okay.